Hi, my name is Chung, one of the cardiologists. I want to talk a little bit about vascular disease today. So coronary artery disease and what the arterial system looks like. A quick reminder of what the arteries and veins do. Everything starts at the heart. Arteries come out, send blood to your brain, your arms, your vital organs like kidneys and liver, then to your legs. And your tissue uses the oxygen that you deliver, and then the veins bring that blood, now without oxygen, back to the heart, which then sends it to the lungs, and then the whole cycle starts again. So generally, arteries take blood away from the heart to the organs. Then after delivering oxygen and nutrients, that blood comes back to the heart through veins to be replenished. That's the general system of the circulatory system. So I want to talk a little bit more specifically about coronary artery disease, or CAD. As you may know, this is a very, very common problem all over the world, but particularly in the United States, where it's a wealthy country. We have a lot of foods that are not necessarily good for arteries. Coronary arteries supply the muscle of the heart. As I just showed you, the heart is at the center of it all. And the heart is a muscle. And like all muscles, it requires oxygen to function normally. The heart pumps out blood through the aorta. And right outside the heart are coronary arteries that run along the outside of the heart. And blood that gets pumped out goes into the aorta. As I mentioned, everything goes to the body, but some of that blood goes down the coronary arteries to provide nutrients for the heart muscle itself. These are the coronary arteries. And essentially what happens is if one of these arteries blocks up because of too much calcium, butter, those kinds of bad dietary habits, cholesterol, that this artery blocks up and not enough blood is delivered to this part of the heart, and you become symptomatic. So there are several stages at which this happens. Let's dive into what these coronary arteries look like. Coronary arteries are basically cylindrical tubes, and blood flows through it, delivering oxygen and nutrients into little branches, which then divide into further branches, and then this is where the heart muscle is divided up into cells. So blood goes down these little streams into little branches, delivers oxygen to the cells. Now, what happens is, even in children, 15, 16, 17, 18-year-olds, there's evidence of disease in these walls. There's some fatty streaks, little yellow fat streaks. And as it becomes more significant, you get a little thickening of the cells. You have calcium. You have other tissue, fibrous scar tissue that build up. So, in fact, if you magnify that atherosclerosis, what happens is you have arteries that come in like this from the outside, tiny little arteries that bring blood to the blockage itself, and there are little areas of bleeding. There are lots of cells. There are little cholesterol spikes. There are little calcium deposits all throughout the plaque. So if you have an artery that looks like this, and let's say this is 60% blocked up, you may not have any symptoms at all. You may get to 70%, have no symptoms. When you get to about 75, 80% blockage, the typical teaching is that you won't have symptoms at rest, but you'll have symptoms when you exert yourself. Meaning, when you walk or climb stairs or go for a run, your heart needs more oxygen. But because of this 75% limitation, it doesn't deliver enough oxygen, and then you have symptoms. Now, what are the symptoms of not enough oxygen to the heart? Most typically, it occurs as chest tightness, chest discomfort, or chest pain. Sometimes it's a burning, Sometimes it's an ache or a pressure. Typically goes across the middle of the chest, radiates down the left arm, sometimes into the jaws and the neck. And when you walk and it comes on and then you stop and it goes away, then you get up and walk again, it comes on, you stop, it goes away. That's usually consistent with what we call angina, or symptoms of chest pain from not enough blood to the heart. So that's called stable angina, where nothing is changing, but it's very predictable, but it occurs regularly. Whenever you do 1.5 flights of stairs, you get the chest discomfort, then you stop and it goes away. Next day you do same 1.5 flights of stairs and it comes on. That's called stable angina. And that's usually what brings people to their doctors often. Now, sometimes what can happen to these patients is you can have a heart attack. This angina then becomes what we call an MI, or a myocardial infarction, another word for a heart attack. Think about what I just described for you. You can have a blockage that looks like this. Let's say it's 50% blocked. This plaque is full of junk, cholesterol, cells, calcium, etc. For unknown reasons. Maybe it's anger, maybe it's a lot of adrenaline, maybe it's just bad luck, maybe it's an infection of some sort. This atherosclerotic plaque explodes. So this covering, what we call the fibrous cap, dissolves and explodes. In some ways, like a little zip that pops. And then what happens is all this nasty stuff that sits inside the plaque starts pouring out into the vascular space. In other words, you could be fine 1 minute and then boom, this could happen. So that's why patients describe heart attacks that occur out of the blue, out of the watching TV and just sitting around, you're feeling okay, and then boom, you get this chest pain. That's what happens. This rupture occurs, all this stuff flows out into the vasculature, and the blood that's going across here constantly mixes with all this unnatural stuff. And then it becomes a blood clot. This artery just fills up with blood clot. Now you have no more blood flow through that area, and then you have a heart attack. This is very, very serious, obviously. So when you have a heart attack that lasts for more than a couple of hours, the cells downstream start to die and don't return. Some people present with rhythm problems. So the heart can just suddenly go out of rhythm when this happens. And then you can just pass out or not come back. So this is a major, major issue. I also have to remind you that a lot of times these things occur silently. So little heart attacks can occur, especially if it's way downstream and not much muscle is at risk. This can happen and you might feel not quite right for a couple hours and you don't make anything of it, then you feel okay. That might be a heart attack. That's called a silent heart attack. And it happens all the time. It also explains why patients sometimes say, hey, I had a stress test last week and I passed it with flying colors and now have a heart attack. Well, what happens is if it's 50% and stable, you'll pass the stress test. You'll do fine. You exercise, the pictures will be okay. But for whatever reason, it explodes and you get a blood clot and there's no way to predict that. So that's why that happens. What do we do about it? Well, it depends on how you present, of course. If you have stable angina, where you have chest pain that's in a predictable pattern, typically medicines can help you with that. So blood thinners like aspirin, Plavix, Brilinta, those kinds of drugs, cholesterol medicines, the statins typically, and then medicines to help reduce the work of the heart, typically called beta blockers or calcium channel blockers that help the heart require less oxygen to do the same amount of work. And we'll talk about that at another setting. But stable angina is often treated with medications. And then we'll get into a little bit later about what invasive options there are. If medicines don't work, then we can go and put in stents, open up the blockages, and mechanically open up the blockage. And we can talk about that at another time. What are the things that can actually make coronary disease worse versus better? things that make coronary disease worse are risk factors such as smoking, the big ones, diabetes, high blood pressure or hypertension, lipids or high cholesterol, and a positive family history. Typically, family members who have coronary disease in their 60s or less. Okay? So these are the big 5 risk factors. Diabetes comes along with obesity and poor lifestyle habits. Similar to hypertension, obesity, sleep apnea, these kinds of things make that worse. A poor diet obviously make lipids worse. And family history, you can't do much about that. But these are the big 5 risk factors, the 5 big risk factors for making this worse. So how do you make it better? Well, you do what you can with these risk factors. This is not a modifiable risk factor, the family history. You can't do anything about that. But everything else, smoking, diabetes, hypertension, and lipids are what we call modifiable. You can treat it, you can change it, and then you can change the course of your life by doing these things. Thank you.